Hello everyone. Today we're going to talk a little bit about Attention Deficit Hyperactivity Disorder, or ADHD. ADHD is a condition in which it's characterized by inattention, hyperactivity, and impulsivity. ADHD is most commonly diagnosed in young people. An estimated 8.8% of children aged 4 to 17 have ADHD. While ADHD is usually diagnosed in childhood, it does not only affect children. An estimated 4.4% of adults aged 18 to 44 have ADHD. With treatment, people with ADHD can be successful in school, work, and lead productive lives. Some symptoms of ADHD can be seen as normal and not a cause for concern to most people, while someone with ADHD would have trouble controlling these behaviors and will show them much more frequently and for longer than 6 months. Signs of inattention include becoming easily distracted and jumping from activity to activity, becoming bored with a task quickly, difficulty focusing attention or completing a single task or activity, trouble completing or turning in homework assignments, not listening or paying attention when spoken to, daydreaming or wandering with a lack of motivation, difficulty processing information quickly, and struggling to follow directions. Some signs of hyperactivity can include fidgeting and squirming, having trouble sitting still, nonstop talking, touching or playing with everything, difficulty doing quiet tasks or activities as well. Some signs of impulsivity can be impatience, acting without regard for consequences, difficulty taking turns, and interrupting others. There are many factors believed to contribute to ADHD. Some research shows that genes can be a large contributor to ADHD, as ADHD often runs in families, and some trends are in specific brain areas that contribute to attention. Environmental factors can also have an impact. Studies have shown a link between cigarette smoking and alcohol use during pregnancy and children who have ADHD. Exposure to lead as a child has also been known to increase the likelihood of ADHD in children. The diagnosis of ADHD occurs in both children and adults, but is most often diagnosed in childhood. Getting a diagnosis for ADHD can sometimes be difficult because the symptoms of ADHD are similar to behavior that's typical in most young children. Teachers are often the first to notice ADHD symptoms because they see children in a learning environment with their peers every day. There is no one single test that can diagnose a child with ADHD, so it's important to meet with a doctor or mental health professional to gather all the necessary information to make a diagnosis. The goal is to rule out any outside causes for symptoms like environmental changes, difficulty in school, medical problems, and ensure that a child is otherwise healthy. ADHD is managed and treated in several ways. Medications, including stimulants, non-stimulants, and antidepressants, can be helpful, along with behavioral therapy and self-management education programs and assistance through school or work or alternative treatment approaches. Some related conditions can occur as well. Around 2/3 of children with ADHD also have another condition, and many adults are impacted by symptoms of another condition as well. Some common conditions associated with ADHD include learning disabilities, conduct disorder, anxiety and depression, obsessive-compulsive disorder, Tourette's syndrome, sleep disorders, bedwetting, and substance abuse disorders. Talking to a skilled professional to help establish an accurate diagnosis can help increase the effectiveness of treatment. This is only a guidance on what to look out for and do, as I am not a licensed healthcare professional. Teen Mental Reset is just meant to raise awareness and break the stigma around mental health issues. The information I got was from NAMI, or the National Alliance on Mental Illness. Thank you for listening and stay well.